At the IMS meeting, we presented data about the depth of serological and MRD response after ide-cel infusion in the phase 2 KarMMa study. And I believe this is important data because there isn't much data yet reported about depth of response after CAR-T therapy in myeloma, and also because of some uncertainty about when and how to measure depth of response with this kind of therapy. We showed that depth of response matter, but also that there are some nuances, and that at month 1 after ide-cel infusion, the only depth of response that matters is MRD negativity because of delayed clearance of the M component, whereas at later stages, month 3, 6 and 1 year after ide-cel infusion, it is important to define the deepest possible remission based both on CR as well as MRD negativity, that to identify the patients that will enjoy the longer progression-free survival. And in fact, we showed that in this study, 15% of patients achieved CR and were MRD negative 1 year after ide-cel infusion, and the median PFS for these patients was 30 months. Lastly, we also uncovered a potential new application of monitoring the reappearance of normal plasma cells simultaneously to MRD assessment as a surrogate for loss of CAR-T cell persistence or functionality, which is helpful to predict outcomes within those patients that are MRD negative. In other words, those patients that are MRD negative but show reappearance of normal plasma cells have clearly inferior progression-free survival, almost like an MRD positive result.